A very good morning to you. How are you doing? I hope that you're well, that you've had an amazing week. It's on Wednesday, and since you were here last Wednesday, God has been good, and we've had such an amazing week. I hope that you have had an amazing week as well, and that you are truly thanking God. We say that as long as you're alive, atakama everything else is not fully working, but as long as you're alive, it's a reason to thank the Lord. All right, so karibu sana. This is MBCI TV ambapo tunabadilisha maisha by the grace of God, and the show on air is the one and only Afya Clinic, where we talk about everything health. All right, so karibu sana. We're gonna have a good time and informative session. All right, today we are talking about hearing loss. Yes, because it's very important for us to make sure that tunasikia vizuri, and just to understand how does that affect us as human beings. Does it affect anything else in our lives? So if you have any question about that, please feel free. Our numbers are very open. That is 0721-105-105-23814. Our SMS code, which is absolutely free. We're live on Facebook, on MBCI TV Facebook page. We're live on YouTube, on MBCI TV official YouTube page, and on all social media platforms as Rachel Kahungu. Ukienda pale, utaweza kunipata. So feel free. All right, this is home. We say that this is a family. Now, I've said that today we're talking about hearing loss, and today we are having Dr. Daniel, who we've had here this year, like 2 weeks ago, yes. And I know that we'll be having a good time talking about this as you understand what is hearing loss as well. But before we get into the topic of discussion and just getting to know our doctor, it's very important for you to get the history of hearing loss. So let's get the in history segment by the one and only Mato.
Hearing loss has been a part of human history for centuries, though its causes and treatment were not well understood until relatively recently. In ancient civilizations like Egypt and Greece, hearing impairments were recognized, but the solutions were often based on myths or rudimentary treatments. People with hearing loss often faced social stigma, seen as weak or disabled. Early medical texts from the time, including those of Hippocrates, mentioned hearing difficulties, and treatments like earwax removal, herbal remedies, and even surgery were attempted. However, there was no clear understanding of the mechanics of hearing or how to address these impairments effectively. By the 19th century, medical research began to uncover more about the anatomy and function of the ear. This era marked the beginning of real progress in the understanding of hearing loss. Early hearing aids were developed during this period, although they were far from the advanced devices we know today. It was also during the 19th century that researchers identified the cochlear's critical role in hearing, a discovery that laid the foundation for modern audiology. However, society still lacked awareness and acceptance of people with hearing impairments, and many were marginalized due to communication barriers and societal attitudes. The 20th and 21st century brought monumental advances in both the technology and social inclusion of those with hearing loss. The development of more effective hearing aids, cochlear implants, and the growing recognition of sign language as a legitimate means of communication transformed the lives of many individuals. Public awareness campaigns and laws like the Americans with Disabilities Act (ADA) in the United States helped break down the barriers, promoting inclusion in education, the workplace, and society as a whole. Today, hearing loss is understood as a complex condition influenced by genetics, age, and environmental factors like noise exposure. Ongoing research continues to improve treatment, offering hope for better solutions in the future.
So get more comfortable in the room. Feel free to ask all the questions you'd want to ask about hearing loss. This is the place to be. Hakuna question yenye iko out of place as long as it's about hearing loss. Hakuna question yenye iko out of place. As I had said before, our numbers are very open. I'll just repeat our numbers. That is 0721-105-105 on WhatsApp, 23814. Our SMS code, which is absolutely free of charge. And of course, we're live on Facebook, on MBCI TV Facebook page. We're live on YouTube, on MBCI TV official YouTube page. So officially karibu sana. Doc, good morning.
Good morning.
How are you doing?
Good.
How have you been?
I'm very fine, thank God.
Okay. Happy and blessed.
Great. Happy and blessed.
Amazing.
Very
amazing.
Strong.
And very strong. That is very important. Perfect. Now, thank you so much for being here once again as we talk about hearing loss. The other time we told the people that tutaiongelea hiyo maneno. We will make sure we talk about hearing loss. And now officially we're here so that we can talk about that. Now, as we start, najua tunaongeleanga to hearing loss. Hearing loss. It's a very common phrase, common word, but in my opinion is that we really don't understand vizuri what hearing loss looks like. So would you just start by explaining to us what hearing loss is?
Hearing loss is when something affects your hearing, like it affects the ability to hear. For example, when you block your ear, you have blocked the system. So it means that your hearing system has been affected. So basically, hearing loss is the affecting is the effect to the hearing system, the whole system from the outer to the inner part of the ear.
Okay.
Yeah.
From the outer to the inner part of the ear, which means there are parts of the ear that we need to understand to just understand what hearing loss looks like.
Yeah, sure.
But maybe before we go to the parts of the ear, ndo sasa tuelewe vizuri what the ear looks like. I know most of the people, the question inakwanga ni mbona sisikii vizuri, and mostly when you can't hear with one ear, it's usually a question first of all. So let's just go to the causes. What are some of the causes?
The causes of the hearing.
Of hearing loss.
Of hearing.
Oh, of hearing loss.
The causes of hearing. One ni uchafu, wax.
Oh, wax.
Unajua sometimes unakaa na mtu kwa gari, unaangalia wax imemwagika kutoka ndani mpaka nje. It's like it's overflowing. Ni kama hiyo asali imetoka. Yeah. So utapata ya kwamba the ear, when the ear is not clean, it will be, the build up of the wax can affect the ability of someone hearing well.
Okay, so it blocks.
So it blocks, the wax blocks. Okay. Alafu pia ingine ni infection. Unapata ya kwamba there are some people who works maybe in at a certain place, maybe kuna hiyo dust, kuna nini, maji. So ikiingia na ingie kwa the ear, sometimes unapata ya kwamba hata mtu anaoga, alafu hapanguzi hiyo the sabuni imeingia kwa masikio. Yeah, hapanguzi. So ina build up and then it forms wax. Another one is head trauma. Head trauma inamaanisha kwamba huyu mtu alijigonga mahali na maybe the ear ikatingizika mahali. Maybe the inner part of the ear ikakuwa affected. So the head trauma, for example, those people they get accidents, others get maybe iyo accidents sana zinaweza zikaleta causes of hearing loss. Another one is medication, some type of medicine ambayo watu wanatumia. Kulikuwanga na dawa ingine kitambo ilikuwa inaitwa chloroquine. Chloroquine, watu walikuwa wakikula chloroquine.
Nimesikia.
Walikuwa masikio haifanyi kazi. And then the Ministry of Education, the Ministry of Health, I think, came and rubbished that drug away, and then it's no longer there.
Okay.
And then another one is acquired hearing loss. Acquired hearing loss mostly occurs kwa mambo ya factories, noise places, noise environment. Utapata ya kwamba inaenda affect the ear. So those are the main causes of hearing loss.
Hearing loss.
Yes.
Let's talk about the wax build-up. Because I remember sisi wote tulifunzwa while growing up that wax is okay. Like wax iwe ina clean masikio yako. But then what causes the excess build-up? Ni wapi sasa inafika inakuwa that your wax is now excess?
Unajua wax ni hiyo, the earwax, it's supposed to be at a certain percentage. Si ile umewachilia, umeacha mpaka mtu akikuangalia tu anaona wax ndani ya masikio. And that is why we have ear cleaning, whereby you're supposed to clean your ear So you find, I don't know, it's to fear or something of the sort, whereby now it has piled and some maybe it's produced kwa wingi. So unapata ya kwamba this person has been like a year plus, has never cleaned the ear. So it causes the blockage of the ear. Obviously it will just block the ear because anything inakuwa into excess, it will block the ear. So inamaanisha kwamba it is in excess, that is why it is flowing, because the wax is not supposed even to be seen. But when you see it's overflowing and now imekuwa mingi, imekuwa ni unaona wengine wanajaribu so it means that they need to see an audiologist. Actually the audiologist and the ENT are the ones that handles mambo ya hearing. So if you see that umekuwa na wax kwa masikio imezidi, or you are feeling like you're not hearing well, kindly visit an ENT clinic or visit an audiologist akusaidie so that wajue ni nini inaweza kuwa the cause. Moja inaweza kuwa imefunga, ingine maybe, but it's always good to visit the ENT. Don't just clean by yourself because you don't know the extent at which wengi wanachukua hizo za kutoa, and then they just but then they remove them by themselves, and others even they can harm the ear. So you don't know if you are harming the middle ear or the inner ear. So it's always good if you feel such a thing, you visit the ENT or the audiologist.
Now let's go hapo kwa inner ear and outer ear. What does the ear look like?
The inner ear looks like a coil. That's why it's called a cochlea. Inakaa ni kama snail-like shaped.
So that's the inner ear.
The inner ear.
So it starts from uko ndani, the ear.
Uko ndani.
And
then now we have the middle ear. The middle ear, whereby now it is it has now, it is the receiver between the outer ear and the inner ear. So dapo inakuwa na, it have like iko na vitu kama iko na inaenda ni kama iko na echoes imekatakata, alafu pia kuna ni kama kichichungi ya kujichunga. So it's like it have things like feathery things zenye zina clean your sound, it regulates the sound, na pia ina clean the anything that can enter from the inner to the inner ear. So iko na ni kitu kama feathery. So it cleans up before anything enters the inner ear.
And then now we have the outer ear.
The outer ear,
which we see.
The one yenye unaona hizo. Yes, the one that we are seeing. So that one now, the trungus and the helix, now they are the outer ear now.
Now when you talk about hearing loss, which part of the ear is usually affected?
The one that is usually affected is both the middle and the inner ear. So itaanza maybe the inner ear could be affected, alafu pia the incus, between the incus and the malleus pale utapata ya kwamba there is a problem. Alafu the tympanic membrane pia, or the eardrum, once it's affected utapata ya kwamba now the ear canal is not taking anything to the semicircular canal. So there is a problem in between the semicircular canal and the temporal muscle pale. So utapata ya kwamba hiyo inner ear iko affected.
I see. So that is what the whole ear looks like.
Yes, that is what the whole ear looks like now. Now the cochlea now, the cochlear nerve takes, now the cochlea now is the one that now regulates the sound, and then now the cochlear nerve now takes the sound to the brain. Now that is where now it connects. Now hapo ndio sasa mtu anaweza kusikia. Yes.
So it's really good that we understand what the ear looks like, because tunaongeleanga the ear and we think it's what we are seeing, and that's just it.
Exactly.
So once we get to understand.
So it is a long process. Actually, it's a very long process.
Yes. Now, This would be the most interesting part, because we get to understand. Let's start with the kids. So for a kid who has hearing loss, what mostly umetupe the causes of hearing loss. So for kids, ni nini ndio inakuanga mostly the cause?
Now, hapo before tufike hapo tunaangalia types of hearing loss.
Or the types of hearing loss?
Yes. Now, we have around 5 types of hearing loss.
Okay.
And it might be conductive, sensory neural. Now, the conductive hearing loss is whereby it's caused by the outer or the middle ear. That's conductive.
Okay.
So either the middle ear or the outer ear has been affected. And then we have the sensory neural. That is the inner ear has been affected, the damage of the inner ear. And then we have mixed. Now mixed is both the inner and the outer ear. Hizo zote ziko na shida.
Okay.
And then we have the central. That is when the central means that the neural nerve, the auditory nerve, the auditory nerve, I think it's there. The auditory nerve imekuwa affected when you talk about the central. And then functional. The functional is when you are using the hearing fully, but now the balance is not there.
Yeah.
Unaonanga mtu, kuna mtu anatembea. You know, both ears zinapeana ni kama center bolt ya gari. Unaona some center bolts za gari mkia iko huku na kichwa iko huku na inaenda. Have you ever seen such a thing?
Yeah.
So it normally gives the developmental balance.
Okay.
So if one ear is affected and that is a functional or the functional type of hearing loss, kutakuwa na hiyo difficult, because the ears actually gives us the muscles zetu, they give us the balance. So hii moja ikitoka hauna balance, unabaki bila without the balance.
Okay.
So actually those are the types. Okay. Now for us to determine the type of a hearing loss of a child, the child must visit the audiologist. The audiologist is the one that determines what is the cause of the hearing loss.
Okay.
Yeah.
So you can't determine the type of hearing loss just because of your age.
No.
Because of what your symptoms look like.
No.
So let's go to the symptoms of hearing loss. Would it be just that I can't hear, ama kuna the early symptoms of, ni kama mtu unaanza kudevelop hearing loss? Are there early symptoms of hearing loss?
Yes, we have the early symptoms of hearing loss. Which actually. Because one, utapata ya kwamba wewe unajua ya kwamba unasikia, lakini watu ambao wako around wewe, mtu labda anakuita and then you don't respond.
Yeah.
But you are doing things normally. For example, if a child don't have a cochlea, atadevelop kitu inaitwa atakuwa na kitu ambayo lip read. They will lip read. So wewe utasema ya kwamba mtoto wangu but huwa ananisikia. Mtoto wangu nikimtuma kitu ananiletea. But have you observed that child will always look at you and they are reading whatever you're saying.
Okay.
Now another, even a person cannot hear for almost even 50 years. But yeye ako very sharp kwa
reading. Yeah.
So unaweza kuwa unaita mtu from the back, huyu mtu asikii. But ukikuja mbele, huyu mtu anakusikia. So this person understands everything.
Yeah.
Because amekuwa develop something that can help him or her to learn the environment. So adaptive.
Yeah.
So those are called adaptive ways of learning. So if you have learned how to adopt and how to cope, you can live very comfortable because you will always, if somebody is besides you, so utamwangalia tu na unaona huyu mtu ako anasema kitu fulani, then you go and then you do it. So for example, nilete kalamu, you know, that person has read everything that you say. So those are some of the characteristics. Another one, ni not responding to anything. Like somebody is not responding to anything. So you will know that this person has a hearing loss. Another one ni ile ya kukusongea kabisa. Maybe you are saying something na nakusongea. That one, it means that that person has another one is blocking of the ears. Inamaanisha kwamba there is a problem there with the hearing.
So if you're speaking to me and I'm blocking my ears,
yes,
that could mean what?
It could mean that maybe the inner ear or the middle ear has been affected. So you need to see the audiologist.
Okay.
Yes.
Oh, wow. All right. Now, when you're not able to hear, does that affect your speech and your language in any way?
True, it does.
How?
At a certain point. Because if you're not hearing, it means that you don't even know what people are saying. But because some lose the hearing or the hearing when they have already developed speech. Others, no, so that person will just communicate normally.
Okay.
That person will just communicate very normal. But for you, you will not know, you will not realize that you have lost your hearing.
Okay.
Because now the people around you will now start discovering, nimekuambia hii, but ufuati, what is the problem?
Yeah.
So you realize that ikifikia pale, now this person needs to seek some medication.
Yeah.
Because now you are not following exactly what people are doing.
Okay.
Maybe turning, or you are not you're not capturing whatever that is being said around you. Yeah.
And it's very hard for you to know. So it's other people who tell you.
Who tells you?
Okay.
Because now the speech, for example, the kids or the people who don't have a cochlea, now it means that they cannot even develop speech because they don't even have anything to say, actually, because those are now the deaf. Now we are now coming to the deaf community, whereby now these people, the deaf cannot hear
at all.
They cannot hear at all.
Okay.
Now the speech will not be there because they haven't. You know, speech is acquired from what we say or what we talk.
Yeah.
So if you're not hearing anything, then it means you cannot acquire anything. Speech. Yes, exactly.
Okay. Now let's come to the people who have an issue with their speech, maybe because they had an issue with the hearing at a very young age. That happens, right?
Yeah, it does.
So how do you go about it? Is it that you'll have to sort the hearing for them to be able to speak, or how do you go about it?
Now, hearing and speech, they go together. Now, once this person has seen an audiologist, now they come for speech. Now, that is where now we come in as speech and language therapist, so that we help these people, we train these people on how to start speaking. Okay. Yeah, because now when you are not hearing, hearing will just directly affect your speech.
Yep.
Because if you're not hearing, then it means your language is not there.
Yeah.
So you need to fix first you fix the hearing first, and then now you come, we fix the speech. Yes. Okay. Because we are just working together. That is now where the rehabilitation comes in. Okay. Yes.
Okay. Because I'm a bit interested in not to deviate, let's talk about speech therapy and teaching people how to speak after that has happened. Umeona mtu wa ENT, audiologist, and amesort story ya hearing. Now, how do we go about the speech therapy? Are you now teaching me how to speak kama kutoka class 1, like this is how you say it, or how do you go about it?
Now, speech therapy is we start from scratch. We start from vowels. We start from alphabet. Yes. Okay. We start from vowels. Now, for example, if a child has a hearing loss, and now this child has not spoken anything, and this person maybe has a hearing aid or maybe has been given a cochlear implant. Now we start by the link 6 sounds. The link 6 sounds are the common sounds that cuts across the speech line. So we start with them so that we realize, tuone ya kwamba anaweza akasikiza, anaweza sema zile maneno, anaweza sema anaweza sema anaweza sema sh, ama O. Okay. So those are the speech. They cut across all the speech banana. We have a speech banana whereby the tongue have to move on a certain level. Okay. So if this child cannot produce the sounds that are along the speech banana, then now it means that the speech is not there. Okay. So we start from zero. We are starting from zero. Okay. You know, for example, today, if I go with you today to a patient who has gotten stroke patient, a stroke patient, you know, a stroke patient is not able. Amekuwa naongea, munapiga story, munacheka, anasema maneno, but wakati stroke imemchapa, hataweza kusema hata hiyo a.
Why?
Hataweza kusema hata hiyo o. Because now the speech, or the speech has been affected. Okay. So you are starting from zero. You are starting to train this person from zero to say a certain. The same to the deaf person who has gained a cochlear implant, or a person who is using a hearing aid. Okay. So you realize that we start from zero literally. Tunaanza kuanza na the common A, E, O, hizo zote. Okay. So tunaanza from zero.
Okay, and that works?
It works.
Okay. Interesting.
But you know, now you have to be very patient, because we can go even years, like 2 or 3 years with that.
Okay.
Yeah.
Oh, wow. All right, and now that happens across everyone, the grown-ups, the young kids, whoever is doing speech therapy, they start from that as they grow. Yeah, others have speech, maybe just lost some few words in speech, sorry. Okay. So you are trying to recover them, but most of them who have got the hearing aid for the first time switch on, or the cochlear implant switch on for the first time, we start from zero. Okay. Yeah. We'll be coming to talk about what the cochlear implant is and the hearing aid, what those are and how that helps. But before we do that, let's get some of the mythbusters that surround hearing loss, so that you'll be able to understand what hearing loss looks like and what that is. And then we'll be getting to hear if these are actually myths ama ni ukweli. Yeah? So Doc atakuwa akitusaidia kuzijibu. Now, the first one says that only elderly people experience hearing loss.
No. Hearing loss cuts across all the ages. Yeah, from an infant to 100 plus 5 years. So it cuts all across.
Kila mahali.
Kila mahali.
Okay.
Yes.
Okay. All right. So the second one is that hearing aids and cochlear implants completely restore normal hearing.
No.
Okay.
The hearing aid can either restore or no. They are only helping. Okay. Because the cochlea, for example, a cochlear implant is a complete thing. So we have a processor, and then we have the the cochlea.
Okay.
So the cochlea is the one that is fit. You know, a patient with a cochlear implant, it means that that patient don't have a cochlea, a fitted cochlea. Alizaliwa bila cochlea.
Okay.
So hii ni kitu imekewa.
Okay.
So if a patient don't have a processor, akitolewa hiyo processor, anarudi to back to to be a deaf person. Haizi sikia.
Let's talk about cochlear and the hearing aid. Alafu tutakuwa tunaendelea na mythbusters. Don't worry, we are going there. We're still going there. So you said the cochlear. Kama hauna processor, ukitolewa cochlear, you go back to.
No, a cochlear inabaki ndani. But processor ni hii yenye unaonanga iko hapa nje.
Oh, okay.
Yes.
Kwa the cochlear, we should have that.
Sasa hii ndio ina connect. The cochlear is the one that the processor ndio inatoa words, inaleta kwa cochlear. So we have a magnet over there. That one. Now that one is a processor. Now if you see the processor, now the processor is the one in your processor. Hapo penye hiyo processor imeekelewa kuna magnet ndani. Kuna magnet hapo.
So a surgery is done.
A surgery is done.
Okay.
And then it is put there. So the cochlea is supposed to be just behind the ear, upper. That is where the cochlea is.
Okay.
So the cochlea is fitted over there. Now the processor, this one is the one that now fits ina spark, inashika. So hii ndio ina process words, inaleta, then inapeleka kwa cochlea. So if you don't have that processor, the black thing with a string and comes that one, now it means that you are not hearing anything. So that is your outer ear.
Yeah. Okay.
Yeah. So if that one is removed, then you just go back to a deaf person.
Zero.
Yeah.
Okay, very interesting. So Ivo Vulume explained that is how our ear works.
Exactly.
That is what happens. So when that can't work, then you get inakuwa fitted.
Yeah, inakuwa fitted.
Okay.
And now, it's a very expensive process. It's a very expensive.
Okay.
Yeah.
Now let's talk about the hearing aid.
The hearing aid. Now the hearing aid is given to severe to profound. That is somebody who has at least some hearing, the ability that this person can at least hear.
Okay.
So it is something that this person is being given a hearing aid to support that, to just to amplify the voice. Ndio huyu mtu aweze kusikia. So it means the possibility of this person having a cochlea iko, anasikia, lakini maybe it's faulty, so anawekewa ndio iweze kufanya nini? Kuproduce kufanya nini? Kutoa sauti, ndio sasa aweze kusikia. The essence of putting on a hearing aid is just to amplify the
So
the
it's
voice.
that your ear is working, ni vile sasa sauti ni kadogo.
Yeah.
So the hearing aid helps you
it helps you to hear louder, so that
works well. Sawa sawa. Let's go back to the mythbusters. It's now very important that you've understood the second mythbuster, that the hearing aid and the cochlea, it doesn't fully restore your hearing. As you've said, the cochlea ikitolewa, you go back to zero, because now that is working as your ear. All right? That's some good information there. The third one, it says that people with hearing loss cannot communicate effectively.
People with hearing or hearing loss can communicate effectively if they follow the rehabilitation process.
Okay.
Akue amefitiwa vizuri hearing aid ama amewekewa cochlea na amefuata the rehabilitation process. For example, anafuata the audiological reviews na pia anaonekana na speech therapist. Sasa ataweza kukua na a full development of speech.
Okay.
Yeah.
So that has to
be...
They
just communicate.
Okay. So that has to be under you going through the process. The process.
Yes.
And actually
the
following every step.
rehabilitation process.
Yeah, and following every step, because Kenyans, tutakuja siku mbili and then you're like, it's working. We are good. Anahepa. We are good. All right, I see. Now, you can continue sending in your messages. We'll be getting to go through them. And our numbers are very open, as I had told you before. On WhatsApp, that is 0721105105 23814. Our SMS code, which is absolutely free. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. Now, we were talking about what are the causes of hearing loss. Let's talk about genetics, kidogo. Because the people who are born and they can't just hear. Sometimes there are people who are born and they partially can't hear, and the people who are born and they completely can't hear. So what happens there?
When a person is not completely hearing, it means that huyo mtu hana cochlea. The cochlea is not there. That person was born without a cochlea.
Is that a genetic thing?
To some extent it might be, and it might not be. So there are some people who have a history of maybe the problem of not hearing kwao. So that might be a genetic thing. Now wengine, they don't have a history. So you have to know exactly what nini ime transpire that. And others now wanazaliwa tu bila hiyo cochlea. It is either genetic or not genetic. So you can't just specify that it's genetic or it's not genetic.
I see. Wow. Perfect.
Because there is always a start. Maybe you are now the one starting a generation of that. So there is always a start of something.
Okay.
Yeah.
Talk to the people who are usually on very loud music with their headphones or earphones, or around places where maybe in factories, and the factories ziko na kelele sana. How does that affect their hearing?
Now that one affects, it goes, and there is the middle ear has the like it has like a wave like feathers. Okay. Now those feathers they are pushed and then zinaanza zinatoka, so inamaanisha ya kwamba masikio yako itakuwa affected. There is some hiyo the hearing system yako inaenda damage. It damages the feathers that are there, so inakuwa damaged. So once they are damaged, then now the hearing will not be. You want the step is now there is that, and then now it affects the whole system. The whole system is between the stepes and the mailers, and then the incas. Now there is that is where now the damage occurs.
Okay.
Now when it occurs, now it is just a free thing. Maana unasikia inaenda sasa inagonga tu, inagonga tu nini huko ndani.
Okay.
Inagonga tu.
Also that now, is why we're feeling the pain.
Yeah, that is now where you feel the pain.
Is that the same reason why sometimes it'd be utatoka kwa loud music, maybe in a concert or tao na kelele nyingi, and then you get to the house and you will hear some ringing sound in your ear? Is that the same reason?
No, those are just flashbacks.
Oh, really? Na vile karibu watu waende hospitalini wako like, what is happening?
So those ones, unless you just go to look for some medication, zikusaidie tu, but it has nothing to do with that.
Okay. Now, let's talk about the people who've, because you've said that hearing loss also comes along with an issue with speech, which now becomes a problem that needs to be sorted. Now, what are the most effective communication methods for the people who have their speech has been affected, their language and speech imekuwa affected? They are going through the process to make it better, but through the process, what are some of the communication methods which would work best for them?
We have picture reading, we have sign language, we have like now if somebody can lip read, can you face this person to lip read so that aweze kufanya nini? But now for a person with a hearing loss, we encourage them to hear, like to get a process that can help them to hear a normal hearing and also have a communicative. We don't encourage them, because if somebody can be helped, then now let this person be helped. But if you cannot afford, then look for an alternative. You can maybe you can have picture readings, things that are very normal for you to do, and things that can help you out. So you can use that as an alternative.
Okay.
Yeah.
Okay. I see. Now we'll be coming back to read some of these questions, but for now, let's get Healthy Living by the one and only Sylvia Wanja. I see time is really running, but tutakimbizana nayo, and we'll be able to get everything that we need to get for this particular discussion. So for now, let's get Healthy Living by the one and only Sylvia Wanja, and then we'll be coming right back. Remember, this is Afya Clinic right here ndani ya MBCI TV, where we transform lives by the grace of God. Today, you'll be here with me, Rachel Kahugo, and of course, we are having Dr. Daniel as we talk about hearing loss. Usiende mbali.
Hello and welcome to Healthy Living. My name is Sylvia Wanja. Today we are going to talk about how to take care of your ears. Taking care of your ears is essential for maintaining good hearing and preventing infections or damage. Here are some of the important tips to keep your ears healthy. Number 1, keep your ears clean, but do so gently. Clean the outer ear with a soft washcloth. Avoid inserting cotton swabs, that is Q-tips, into the ear canal, as they can push wax deeper and cause blockages. If earwax buildup occurs, use eardrops or see a doctor for safe removal. Number 2, protect your ears from loud noise. Use earplugs or noise-cancelling headphones in loud environments, e.g. concerts and construction sites. Keep the volume moderate while using earphones. Follow the 60/60 rule, that is 60% volume for no more than 60 minutes at a time. Take breaks from loud sounds to allow your ears to rest. Number 3, avoid putting foreign objects in your ears. Do not insert objects like pens, bobby pins or fingers into your ears, as they can cause injury or infections. If you feel discomfort, consult a doctor rather than trying to remove blockages yourself. Number 4, keep ears dry to prevent infections. Dry your ears gently after bathing or swimming using a towel. Tilt your head to drain excess water from the ears. Wear earplugs when swimming to prevent swimmer's ear, that is an ear infection from trapped water.
So we are back after the healthy living segment by the one and only Sylvia Wanja. I hope that you've learned something from there. I really hope that you've learned something from this. So if you have someone who has an issue with their hearing, this is to let you know that there is help. We keep saying on this show that it doesn't matter what you're going through in terms of your health, there's help. It's not always the end. There is help, okay? And that is why today we are talking about hearing loss, and just to know how you are supposed to go about it. But this is a very important question, yeah? For someone who is having issues with their hearing, or their kids, let me use a kids. For someone who has a kid who is having issues with their hearing, and then they won't notice quite fast. So mtoto ameenda yuko around 4-5 years. Can it be reversed? Is there a way to go about it? What is the management like?
Now, I just go back to the rehabilitation management. Once you realize that your child has a hearing loss, check around and see if you can get the help from an audiologist. Because now once you get the help from an audiologist or an ENT, now it means that you will be sorted.
Yep.
Now once you are sorted with those two people, or those two professionals, now you can now come for us as a speech and language pathologist,
Okay.
tukusaidie, tuone ya kwamba now, how can we help you get start now gaining the speech.
Yeah.
Hearing is about, it's a process that needs now mtoto asikie na aweze kuongea.
Yeah.
So we really encourage early interventions. When your child is around 18 months, check on the behaviors of your child. Just from 6 months. Just from 6 months, a child, when you clap, maybe a child will turn, a child will listen. Do something that can trigger this child to see if the child is turning. And the earlier, the better. Because if you do the hearing test early in the house for your child, it becomes very, very easy for even a child to gain speech. Once a child is given a cochlear implant or a child is given a hearing aid, now mtoto anaanzia pale. But now, that is why I'm saying we as parents, we are busy. And we don't even realize when our children are having difficulties in hearing. So the earlier, the better. If you start early by doing these tests, even in our clinical books, when you go to these, to the books that these mamas are given in the hospitals, you will always have, the Ministry of Health has done a very good job. They have given you that at 6 months, mtoto atafanya hii, at 12 months. But you know, most people just take them to the doctor to sign. You know, if you go to a hospital and wamesema ya kwamba mpe dawa at this, that is usually kazi ya daktari. So yeye ataenda mpe dawa na hiyo kazi yake imemali. But you have been given notes to read. Can you read through the notes? Ya kwamba at a certain time, a child is supposed to blink the eyes. At a certain time, a child is supposed to smile. To give a smile. You see, at a certain time, a child is supposed to be doing things in the house, calling names, doing this. At a certain age, a child is supposed to turn or to do something. So just go through those books, especially for the people who are still in the process of getting children. So it's good for people to read the book so that you can test at certain at a certain time you test, unaona kwamba mtoto wangu hapenduki, afanye nini. So that is now when you can get the early intervention. Very important.
Okay, okay.
Yeah.
Now, at what point are you supposed to know that this kid is having an issue? Is there, kama nikiklap na mtoto haangalii, can I take that kid at 6 months kwenda kuangaliwa to test?
Kabisa. That is now the right time for you to go and test that child.
Okay.
Usingoje mtoto aanze kukwenda miaka 2, 3, 4. Others even realize after 5 years. So 5 years even having a cochlear implant is a very long process.
Okay.
5 years maybe huyu mtoto aone speech therapy for another 5 years. When is this child going to gain speech? So it becomes a problem. And that is now where the professionals comes in and then wanasema ya kwamba huyo mtu ama huyo professional hata kazi yake hawezi. But if a child has been brought to me at the age of 2 or at the age of maybe 3, 2 to 3 is an early intervention thing. So you realize that this child will just speak speech because atapewa instruction na speech therapist. Wazazi watachukua, nani atachukua? The community will come in and this child will just speak. But unapata ya kwamba most of these kids wamefungiwa ndani, maybe they have their nannies and they have their parents. And when a parent realizes that, and this is where the mistake comes in. Most parents, when they realize that their kids have a problem, wantaki huyo mtoto interact na watu wengine. Wanawafungia tu. That is where now they will go and look for own compounds. That's where now they will move from a plot because wanaona ya kwamba mtoto wao hasaidiki mahali pale. But you did not do the early intervention mapema. So it's always good once you realize something, can you look for professionals because they are there to help you out and then you gain whatever that you want from your child.
Okay. Does interacting with other people help with the speech, especially for kids who are just growing? PP1, PP2?
Yeah, play group, PP1, PP2.
Yes, that one.
It does.
Okay.
It does.
And might that affect your language and speech as a young kid, especially when you can't hear very well? Would that affect in any way?
No, no. If you're not hearing, then there is nothing you can do. Even if you interact with 1,000 plus a day, there is nothing that will change. You just have to go back, get tested, go for better test, go for tests, go seek professional guidance.
Okay.
Yeah.
Amazing. Now, tulikuwa tunaangalia the mythbusters. Now that will bring us to the last mythbuster, which you've clearly cleared the air on that. Maybe we'd get it on the screen. Let's get the mythbuster. So what we just talked about is now clearing the air for the last mythbuster, which is if a child has a hearing loss, they won't be able to speak.
If a child has hearing loss, they won't be able to speak only if the interventions have not been given or the interventions have not been put in place. But a hearing loss child can speak, can communicate, and can do things very normal. So the only thing that they need to do is the intervention. That is the only thing that can help in the process.
Now let's talk about the challenges that especially kids with hearing loss face, especially in a school setup.
In a school setup, most of them face bullying because this child is not able to communicate. They also face like discriminations. And we are living in a community whereby teachers even are not enlightened. Most teachers don't know what it is even for a child that because if a teacher is not a specialist teacher, won't even know whatever that this child. But if you go to a school and then there is a specialist teacher, this teacher will approach it in a very different way. Maybe they're discussing in class na aseme kwa ofisi, because obviously they always discuss mtoto fulani ni kama anisikii. So the teacher will do the assessment. I think the teachers have the assessments, the assessment tools that can enable them. The special needs teacher, they can help them to know that mtoto fulani yako na shida fulani, this and this and this condition. So if those things are put in place, utapata ya kwamba huyo mtoto atasaidika. Another challenge that these kids face ni frustration. Obviously, you're not getting anything. So you will be frustrated. And then now, once you're frustrated, the academics of viewers will now drop.
Go down.
Yeah, they will go down.
Okay.
Yeah. So those are some of the challenges ambazo watoto wanapitia.
So you should be more intentional on making them feel more at home and including them in our, day-to-day life, which is very important. But we'll be talking about why it's important for us as a community to be able to just accommodate all of them and how we can do that. And one of the ways that you've told us is identifying how these people are able to hear us. Kama huyu ni mtu mwenye unaona anaweza kusoma lip reading, anaweza fanya lip reading, please be more intentional with that. Please, as a community, we'll be coming to talk about that. But for now, let's take a very short break and then we'll be coming right back. Please remember that this is MBCI TV ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is the one and only Afya Clinic, where we talk about everything health. Today, we are talking about hearing loss, and we're here with Dr. Daniel. And of course, your graceful host, Rachel Kahugo. A very short break and then we'll be coming right back. Usiende mbali.
MBCI Television, transforming lives.
Welcome to Gilgil Hills Academy, a mixed day and boarding school, the one-stop school of educational opportunities for your child.
We are strong together in learning.
We are located within Gilgil town in a serene and homely school environment. We offer the best competence-based curriculum at its best. A strong team of highly skilled teaching staff is on hand to provide, with great attention to detail, a stimulating, individualized learning experience for your child. Our rich programs and wide range of facilities allow your child's maximum exposure, participation, and convenience in learning. Come and be part of the greatness of the Gilgil Hills family by calling 0794 952 635 or 0710 308 818. Your child deserves the best. Gilgil Hills Academy, the real school with a difference.
Juma hili tumeangazia hili.
Stooge ni aina fulani ya upendo ambao watu wanaweza kupendana. Una uungu ndani lakini hauna mahaba, hauna eros ndani.
Na hili,
tukiangalia Shadrach, Meshach and Abednego in a foreign land, they had position, they were respected, they were honored. The king feared them.
Na hili pia,
kuna venye tume interpret mapenzi in a different way, venye haipaswi. Sasa unasema mapenzi ni kupewa pesa, mapenzi ni nywele itengenezwe, mapenzi ni nguo inunuliwe, mapenzi ni unipeleke na jet.
Tumeona mtu anakonda, anajikondea kabisa, anakaa mzeti kwa sababu ya mapenzi.
Mazungumzo haya, maisha na Biblia, ni kila Alhamisi saa 1:30 hadi saa 4 asubuhi. Yanakujia moja kwa moja na kwa wakati mmoja ndani ya radio na runinga wipendayo ya MBCI. Tunabadilisha maisha.
MBCI Television, transforming lives.
All right, we are back after that very short break. Simeona, it was a short break. This is Afya Clinic, right here ndani ya MBCI TV ambapo tunabadilisha maisha by the grace of God. My name is Kahugu and today we're talking about hearing loss. Tuko hapa na daktari ambaye anaitwa Dr. Daniel. Now, we've been talking about hearing loss and you mentioned a few things. But sasa, we have people who love to do home treatments, especially with issues za macho, maskia ENT in general. We love to treat ourselves, baka tuone sasa it's bad. That is where we go to hospital. We'll be coming to a specific one yenye tumeambiwa hapa to wonder if it's something that works. But tell us about home remedies, if there are any home remedies for hearing loss.
Personally, as a professional, I don't encourage anybody to have a home remedy for the hearing loss. Because you can do something that is not out of you do something and then it damages everything. So it is always good if you have any problem with your ear, kindly visit the ENT around you or the audiologist around you. Hiyo itakusaidia. But you can do something and then it ends up damaging everything. So the only home remedy yenye naweza nikasema maybe ni clean. Cleaning the outer part of the ear, but don't go inside. Just clean for the hygienic purposes. But now beyond there, leave it to the person who is trained to do that work. You don't just go and then unaanza kuchokora masikio, unaanza kuchokora, alafu baadaye unataka sasa daktari aripe tena hiyo masikio. Mahali penye wewe uliharibu. It's always good for you to look for a professional akusaidie ili uweze kufanya nini? Kusaidika. Yes.
And as you're talking about cleaning the outer ear, kuna watu wanatumia, and I know the earbuds, please don't crucify me for that. Kuna watu tumia earbuds and kuna watu tumia miti ya kibiriti. Like there's wengi. Yes. They always, especially when una feel the irritation. People do that. Is that healthy or not?
It's not healthy.
What are they supposed to do?
They are supposed to get like now the earbuds. You're supposed to just clean it from the outer. Make sure that you have some liquid ambayo umeweka. Very clean, something that can just wipe out the outer part, the outer part of it. But don't go deeper, because now when you go deeper, you will affect the ear. So just clean. It's only the purpose of that. It's only to clean the upper twinge, si ndani. But now people goes and then wanaingiza ndani hivyo, so that is now where they bring in the damage.
Okay.
Miti ya kiberiti haitakikani mahali popote.
Hata kidogo. Yes, please. I hope you've had that.
Hiyo ashie tu moto.
Yes, please.
Yes.
Now, I've seen someone asking about ile time you've gone probably for swimo or all that, and you have water in your ears. What is the best of getting rid of that?
Now, most of the time, the water that goes in the ears, when you sleep, huwa inatoka tu. But now you can, if you have, kama uko na hiyo haraka, you can visit the clinic, then utasaidiwa. But most of the time that one ukilala huwa inatoka. Because the ear cannot contain any other substance. Itaitoa tu. Yes. Yeah.
I have a very disturbing question that I once had as a remedy for that. When someone said that ukiwa uko na maji kwa this ear, you should put clean water kidogo tu in this ear, and then that helps you, like ita
balance. Wewe ishawahi kufanyikia hivyo?
I have never tried. No, please.
So there is no that. I don't know if it is there. Unless now I ask my colleagues who are audiologists. Maybe they can explain to me that. Okay. But I don't think if that is a remedy. Because why should you put a substance in this ear when this one has a problem? Are you damaging all of them? Do you want to damage all of them? You need just to seek for some professional guidance.
Yeah. That would help. That would help. Let's talk about liquid paraffin. I see we have someone who's saying they used liquid paraffin for earwax. Had excessive earwax, then used liquid paraffin. Sijui kama iliwaka ama haikuwak, but is liquid paraffin medicine?
It is okay. Liquid paraffin. Okay, personally, I can't advise somebody to use anything unless it is subscribed. It is like subscribed from the professional. So it is always good for you to consult a professional to help you before you decide to do any other thing. And that is where they are there.
Yeah.
Why should you come in with your own remedy to do something?
While you can get help.
You know, hearing, the ear is a very complex organ.
Yeah.
So it is always good for you to be very keen before you do anything with your ear.
Yeah.
Just consult. It costs you nothing to consult, and it costs you nothing to get help from a professional.
Yeah.
Yeah.
Okay. Perfect. Now, we have a few photos on the screen. Let's take a look at it as we talk about the you called it
the speech banana.
The speech banana. The speech banana. Also, you'll be telling us, is that a way that someone can try to see if they have an issue with their speech? Because I understand there are people who just have a heavy tongue, and that's a thing. So we'd be looking at that. Tell us how to use it. Kidogo tu.
Okay, now we have the frequency. The frequency, that is the pitch in a circle per second. Those are the pitch now.
Yeah.
And then we have the hearing level. The hearing level carries from 0 to 120, and then that is the HZ, and then decimals. Now the hearing level, that is the frequency that is there. Decibels. The decibels are then the sounds. The sound that is supposed, a person is supposed to hear the sound from 0 to 120. If it's above 120, then your ear inakuwa affected.
Okay.
Masikio yako inaafektiwa. Unaona hapo kwa 120 ni vitu plane, aeroplane na nini. Alafu hata 10, hata 100 unaona ni truck, nini. They are not that much. Nini. They are not that much. Now you see that all the sounds that are, we have the 6 link sounds across there. We have the 6 link sounds. Tuko na sh, tuko na a, tuko na e, umeona? Tuko na shi mahali, tuko na a mahali. A, now the tongue has rested. A, you open your mouth. Sh, your 4 parties now speaking, and then we have this. And then we have the O. Now the O comes in there. Yeah. So all those they help you they help in the sounds, especially the ones that have just received the cochlear implant. So the speech banana helps us to detect if this person is getting all the sounds. Okay. So the speech banana is mostly used by the professionals. And now after that, if a child has been given the cochlear implant, sasa inakuwa transferred back to home. Before uvalisha huyo mtoto una test this frequency, and also you test the hearing level of that child. Okay. So that one helps it sana helps the child. Now you see that now on this other side we have the range of hearing loss. Yeah. We have the normal hearing, it is there. The normal hearing is in between 10 and 20, that is the normal. And then the mild hearing is between now the 20 and around 50 there, around 20 and 60. And then the moderate one, then the mild, now the profound, and then the severe. Now between 80 and 90, hapo huyo mtu kusikia vitu inakuwa ni tricky. And then the profound. Now profound ni hiyo ya huko chini, ambayo sasa hearing yake iko na shida. Yes.
Okay. So, and kwa hiyo range yote, depending on where you're at, now you'll decide on what direction the speech therapy should take. Now you
take now from there. Now we determine, we check on those sounds that are on the speech banana, and now we determine how we can now help the patient.
Okay.
Yes.
Okay. Now and this is a question that I've just thought of right now, for the cochlear implant, is there any time that maybe while sleeping kuna any time unatakana kuitoa?
Yeah.
That should be?
That is the moment unatoka tu hivi kwa malazi, mtoto anaamuka hivi, ama mtu mwenye ako na cochlear anaamuka, anawekewa. That is now when that person is starting to hear. Okay. Wakati anaenda kulala, anatoa, anaweka kando. That is now the time, because now you are resting. Yeah. Because you can't sleep, hiyo haitaki sweat, haitaki nini. It will be damaged. Okay. Now the processor, not the cochlear itolewangi.
The processor.
Yes, the processor, the out part of it.
Okay.
The processor, yes.
Okay, I see. But at least you've seen there's help. There's help for that. So it doesn't matter. See, I love what we always say, and I'm sure I've said it on this show again, that there is help, and it doesn't matter uko umefika wapi. You've had kuna implants, kuna anything, as long as you start the process. As long as you start this process, speech therapy, whatever it is. But as Doka said, the earlier, the better.
Yeah.
The earlier, the better. Before we finish up with this question, I'd love for us to now take a look at some of the sign languages that you need to learn. On the other time we were here, while we were talking about we were talking about autism.
Autism,
and
yeah.
we had our teacher.
Yes.
Morara.
Morara.
Yes, had a teacher Morara, and she taught us some sign languages, and I hope that you remember them, because we said it's very important for us to at least have some basics of what you're supposed to do and how you're supposed to, communicate to the people who can't actually speak. Okay. Now let's take a look at some of the sign languages and see what we have there. I wish you were here with her today. We are a bit good at it. So this is A to Z. This is very interesting. This is A to Z. But now I'd love to know, when you need to say your name, will you have to master R-A-C-H? But that's quite a lot. We'll have an episode where we just literally talk about sign language. Probably we'll have Morara again talking about sign language and how to learn it, and that will be really important. But get that chart. You go online, I'm sure. Get that chart. It's for sign language. That will really help you while you're speaking to someone who has an issue with speech, or someone who has hearing loss. That will be really of help. Now, we are almost winding up, and we'll be giving a number at the end. So just in case there's something that we haven't talked about and you'd want to be helped, we'll be giving a number and you will be getting help. But before we wind up, I'd love for you to just give an advice to the parents in the community, for people who are living with people who have an issue with hearing. What are they supposed to do to include them more into their lives and make them feel accepted, and just know that they're normal as everyone else?
Okay, the advice I could give to the people living with people with that is in the deaf community or the hearing loss, it is always good for you to seek the guidance from a professional to test where the level at which this patient is, so that now you can be advised well on how to live with this patient of yours, or with your person, or with your family. So it will be very important for you to seek, first of all, take the first step, seek the professional guidance, and from there they will give you the guidance on how to go about and how to help the patient. So it is very important for you to take the first step, that is the visiting a clinic, a ENT clinic, or an audiologist clinic, for you to get the guidance from there, and now everything else will just follow.
Okay. Okay, perfect. Now, for the people who've heard you speaking today, and they've realized that some of those issues, probably they have to read your lips. Read your lips. Read your lips.
Lip reading.
Yeah, lip reading. They have to do lip reading for them to understand what you're saying. Ama they have to come near you, kabisa, so that they can hear what you're saying, and they've realized they need help, or they have someone who needs help with speech therapy. Where can they get you?
We are at CK Patel, third floor. That is Nakuru ENT. That is where they can get us. And if anybody has any question concerning the hearing loss or the hearing rehabilitation, they have, I think they can use the office number so that they can get either Dr. Rachel or Dr. Sitima. They can give us a good direction on that.
Okay. Right, so the office number is right there, Nakuru ENT, it's there on your screens. So make a call, get help. We've said that there's always help. Sawa sawa, there's always help. So please feel free. It's very important for you to always get help. Usikia hapo nyumbani and now you're saying you have a kid who can't hear and you're feeling like your kid is not as important as every other kid, or you yourself feeling like you're not as important as everyone else just because you have an issue with your hearing. We've said that there is always help. Sawa sawa. So thank you so much, Doc, for coming.
Thank you so
We
much.
do really appreciate.
Asante.
We've had a good time right here. Now, we'll be looking at Did You Know? Of course, unajua ukiona Did You Know inamaanisha kwamba tunaenda kumaliza kipindi ya leo, which has been really amazing, and we've learned about hearing loss, what you should do and what you shouldn't do for you to make sure that your hearing remains very healthy. All right? So send this link to your friends, send this link to your family members, and it's going to be of help. Let's take a look at Did You Know? Did you know that an ostrich's eye is bigger than its brain? Really? Macho ya ostrich ni kubwa kuliko brain yake? Yeah, me too. My thought exactly. We are having people wenye wako tu na mshangao hapa ndani. But yeah, it's good for us to research and research more. We say that every day when you have the Did You Know segment, it's for us to go and do more research. So Google, research as much as you can and see how true or how not true that is. Okay, so that has been it for today. Thank you so much for your time. We do value your time. Thank you for spending time with us. Thank you for listening to us. We are truly grateful, and I know that you have learned something from today's show. If you need help, please reach out. There's always help. All right? Thank you so much, Doc, for coming. Thank you for being with us on these episodes.
Thank you.
And I know that people will reach out, those who need help, and they will get the help that they need.
Definitely.
Yeah. All right, so we'll see you next week on Wednesday for Afya Clinic, but of course hapa katikati tutapatana kidogo here and there. Tukipatana, say hi. All right? Okay? Thank you so much. God bless you. God be with you. Enjoy the rest of your viewing right here at MBC ITV. We have so much lined up for you, so do not miss out. Have a blessed rest of the week. Bye-bye.